crowding of teeth. Because of so many bad habits, the crowding of teeth happens. Because of thumb sucking, or tongue thrusting, or finger sucking, or so many tongue thrusting also. Because of so many oral habits the children will have. So pencil biting, or pen biting, or collar biting, or pin biting, or any hard substance, if the children use it to keep in the oral cavity, according to the hard substance biting, the teeth also will get flared out. Because of incompetent lips, because of this flaring of upper maxillary teeth and lower mandibular teeth, there will be incompetency of upper lip and lower lip. The upper lip and lower lip won't meet each other. So the maxillary arch and mandibular arch get protruded out and looks very unaesthetic, very awkward. Because most of the patients, if the crowding of teeth and proclination of upper jaw teeth and lower jaw teeth, they will have this oral breathing. Because they won't, because they will mostly breathe from oral cavity. The nasal passage, sometimes they will the nasal passage may obstruct with nasal polyps, or ethmoidal polyps, or maxillary polyps, or paranasal sinus polyps, or frontal polyps. So the crowding of teeth, the tongue also will influence. Because of excess force of tongue also will flare the mandibular teeth into protruded condition, and maxillary teeth into everted condition. Because the maxillary teeth and mandibular teeth will be everted out. The upper labial frenum will be attached at the high frenum and low frenum, like that. Even lower mandibular frenal attachment also high frenum level or low frenum level. So according to that, there will be pursing of lips, or incompetent lips. Because the lips won't match, or won't close, or won't touch the upper lip and lower lip. So this is due to crowding of teeth and proclination of teeth, and proclination of maxillary arch, like a procline. Because proclination means the name indicates the procline also, the forward projection of spikes. Like that, there will be forward projection of these upper maxillary teeth and lower maxillary teeth will procline out. Because in these cases, there won't be there will be dribbling of liquids from angle of the mouth, or sometimes the proclined arch patients, if they talk, there will be spilling of saliva, or spilling of aerosol spread may occur. Because the lips won't close while talking. So there will be droplet spreading from proclinated patients. So the orthodontist can correct this proclination of either maxilla or mandible according to the arch, shape of the arch. In proclined arch patients, the proclinated arch, the arch, mandibular and maxillary arch will be in a V shape, just like a V shape, not in a U shape. In a healthy round face or square face or athletes, the mandibular and maxillary arch in arches are in U shape or parabola shape. But in this proclaimed cases or incompetent patients are crowding of upper jaw teeth and lower jaw teeth, the arch is in V shape because the tongue won't accommodate in this V shape, so that the shape of the particular patient's face is bird face or conical face. So the tongue will push the arch anterior quadrant of these incisors furtherly, and there will be sometimes open bite also. Open bite means at the incisal edges of upper maxilla and mandibular and lower mandible won't meet, and there will be space. That space is open bite. So there will be escape of air while talking. So there will be lisping of voice problems, lisping of voice. Sometimes the patient can't pronounce some words like some complicated words. So there will be lisping of voice and escape of fluids from the oral cavity, and there will be dribbling of oral cavity, and the patient can't swallow the liquids and solids from the oral cavity into gastrointestinal system. So the arch will be elongated and protruded out like Paget's disease. In gigantic patients, there will be Paget's disease. There will be protrusion of mandibular protrusion and maxillary protrusion forwardly, and the arch will be in V shape. So in this V shape patients, there will be more chances of tongue biting because the tongue won't accommodate in this V-shape arch. So the periphery of tongue continuously the patient will bite, and there will be tongue bite very frequently because of dislodgement of tongue in the lingual in the mandibular arch. So the repeatedly left side and right side, even left side and right side tongue bite is most common in molar and premolar area because of incompetent lips and non-meeting of upper incisal quadrant and lower incisal quadrant. The tip of tongue never bite because there will be open bite problem. So buccal, even buccal mucosa on left side or right side get affected because of this narrow arches, and after taking food, the mouth can't accommodate more of food because V-shape arch patients, they will engulf food. They can't chew properly because the tongue won't allow more of food into oral cavity. There will be difficulty in mastication, difficulty in chewing, difficulty in grinding of food, difficulty in chopping because the tongue itself will, there will be lot of congestion with tongue, and the patient can't small intake of food will accommodate in the oral cavity. So because of urgency, the patient will swallow the hard consistency food into gastrointestinal system. So the indigestion problem is more common in protrusion of teeth because of the occlusion of upper arch and lower arch can't chew properly or masticate food properly. So the patient will have this indigestion problem very frequently. So at the age of 18 to 25 years below, the orthodontist can correct this malocclusion of upper arch or mandibular arch or protrusion of maxillary arch or mandibular arch. Even orofacial surgeon and this orthodontist can rectify this ugly protruded upper arch teeth and lower arch teeth in intact condition. So this V-shaped arches are more common in bad habits of pen biting or pencil biting or chalk piece biting or thumb. So this crowding of because of bad habits in childhood, pencil biting and thumb suckling, tongue thrusting or pen biting or collar biting or any bad habit will influence this narrow arches of both maxillary arch and mandibular arch, and it will in turn results in so many metabolic imbalances, gastrointestinal problems and nasal problems, because there will be chances of polypal growth in nasal polyps or maxillary polyps or mandibular paranasal polyps or frontal polyps or maxillary polyps may very frequently in this elongated arches or open bite patients. So open bite patients, they usually take oral breathing. So in oral breathing there will be lot of dust in air, so much of dust and pollen grains and biodegradable plant dust and acidic fumes and chemicals and so many pungent flavors will inhale from the oral cavity. So there will be chances of upper quadrant and lower quadrant gingival tissue will get affected with gingivitis, chronic gingivitis, and there will be pus discharge and there will be bleeding gums and there will be foul smell while patient is talking with the doctor. So the direct, there won't be any filtration of inhaling air because the nasal passage get affected with nasal polyps, and this inhaling air with oral cavity will all the dust particles, chemical fumes and pharma fumes and this acidic fumes and biodegradable plant dust particles and this fungal spores and bacteria and virus can directly hit onto nasopharyngeal joint or upper respiratory tract, and repeatedly the patient will have these upper respiratory tract infections and tonsillar infections, quinsy, peritonsillar abscess and chronic tonsillar infections, and this rheumatic fever will leads to cardiac regurgitations and mitral stenosis and mitral regurgitation, aortic stenosis and aortic regurgitation. In these cases most commonly we will come across in these patients. So the mouth mask should be open bite condition patients should use mouth mask, double mask or triple mask is very advisable because it will filter the dust particles, the pollen grains, the acidic fumes and direct chemical flavors or any even insects also. In some cases the house flies house flies and mosquitoes also, because of open bite, the insects also will enter into oral cavity, and they may lay eggs in oral cavity, because foul smell will attract the mosquitoes and house flies and other arthropod animals. So be careful, and it should be rectified with orthodontist to correct these proclinated arches into reclination or perfect arches. So thank you so much for watching. Thank you so much for watching JRTV. Please press bell button so that every update from JRTV will be updated to you. Please comment on uploading videos, so that your comments are our best stimulations. Your comments are our best energizers. Your comments are our best extra added backbone to JRTV channel. Your comments are our extra added supporting words to JRTV channel. Please share it in your big friend circle. Please share it in your big family circle. Please share it in your big student circle. Please share it in your big international clientele circle, so that every update from JRTV will be updated to them. Thank you so much for watching. JRTV signing off.